It's time for your sonohysterogram. Now, this is one of our diagnostic tests that's designed to take a look at the inside of the uterus. With just a normal ultrasound, all we get is a view of the uterus that looks like the side of a peanut butter sandwich. What we want to look at with the sonohysterogram is whether or not there is anything inside the uterus. So we put a little bit of saline inside. When we put the saline inside, it opens up the inside of the uterine cavity, and we are able to see if there's anything in there, like a polyp or a fibroid. So going back to the peanut butter sandwich analogy, a regular ultrasound takes a look at the side of the sandwich, and the sonohysterogram opens it up to let us see if it's creamy or nutty peanut butter, and really if there's anything in there that we need to go in and remove before we start your treatment cycle. We want to make sure that you are no longer bleeding on your period, and that there's no way that you could be spontaneously pregnant, with this being the magical cycle after all these others that haven't worked. We still want to make sure we're not disturbing a pregnancy. So you'll come in, we'll have you lay back, put your feet up. We will then put a speculum inside the vagina to take a look at the cervix. We will clean it off, and then we'll very gently pass a catheter through. Once we put the catheter inside the uterus, we're going to put just a very small amount of fluid inside. If you think of a shot glass having about 35 milliliters of fluid or so, we're only putting in 10 or less. So it's a very minimal amount of fluid. Some women feel a bit of cramping. Some women don't feel much at all. Many women feel the fluid come right back out, so we always give you a pad to protect your clothing. And then after that, you're free to go about your day, and we're going to take a look immediately to see if there's anything inside the uterus that we might need to address. Polyps and fibroids are the most common things that we see. Typically, as soon as we're done with the procedure, we know whether we will need to do any additional procedures to remove any abnormalities within the uterus or not.